I would like to first thank the Illinois Public Health Institute, who is facilitating this webinar for us today, and they handle the registration, and I couldn't do this without them. So thank you so much to the support of the Illinois Public Health Institute. These webinars, this is the fourth one that we have done now. They are really possible because of the Illinois chapter of the American Academy of Pediatrics and the Illinois Public Health Institute, their support through the iSpan grant. We are working hard here in Central Illinois and throughout Illinois. There are 3 areas that have the iSpan grant, and we are working hard to improve breastfeeding initiation and continuity rates amongst our underserved rural and Black families. And I do feel like we are 3 years into the project that we are starting to move the dial and seeing some results from our work. So thank you so much to iSpan, IPHI, and the Illinois chapter of the AAP for their support in this work that we are doing. I'm not going to take too much time, but I want to tell you about the next webinar that we're going to be having coming up. That will occur on Tuesday, September 21st. From 12 to 1 p.m. I will send information out about it, but the title of the webinar is going to be Insurance Coverage for Lactation Support Services in Pediatric Practices. So I think that there will be a lot of people who would be interested in that topic. This is basically how can you get paid for the breastfeeding support that we are providing in pediatric practices. Dr. Malika Shaw is going to be presenting that webinar for us. So again, you can mark your calendar. I will be sending information out, but it's Tuesday, September 21st at 12 to 1. To go on with what I'm really excited about today, and that is introducing our speaker, Joanne Allen. Joanne sent me some fancy words about the work that she does, but I would just like to say I met Joanne, I don't know how long it's been, Joanne, now maybe 10 years ago at a March of Dimes conference that I was speaking at, and I was just enchanted by her passion at that time, and I've had the opportunity to work with her a couple of times since then, and I am more amazed by her passion. So to tell you a little bit about her, I know we've got some of her friends on, and she doesn't need any introduction from me, but Joanne has over 40 years of experience working with infant care, maternal care, breastfeeding support. And in addition to all these years of clinical experience she also does a lot of professional presentations on infant care and specifically with breastfeeding topics. More than anything, she's just, her passion is incredible. And we are so lucky to have her speak here. Joanne is pretending to be retired, and I think that she will tell us that she is actually refired, and it seems to me that her fire is burning as brightly as ever. So thank you so much, Joanne, and I'm gonna pass it over to you and share your wisdom with us.
Thank you, Beth. Thank you so much. And I want to just start by thanking all of you who are here today, because that in itself shows me that you have an interest and a passion for helping our mamas. And that's what it's all about. I'm not going to take a lot of time other than to welcome you. Thank you for being here. I appreciate you, and we're going to get started. I do want to remind everybody, because I've learned the hard way, to ask you to please mute. And also, if you have questions, put them in the chat. And Beth, are you able to hear me okay? If so, then I will go ahead and get started.
I can hear you great, Joanne, and I will monitor the chat and chime in as needed.
So today we're here to celebrate Black Breastfeeding Week. It actually began on the 25th. It goes from the 25th to the 31st. And cows and discover the power of breastfeeding in Black communities is the title, and let's go. So I'm clicking, I'm trying to, okay, now I can get started. I'm clicking and nothing's happening. So I am Joanne Allen, your presenter today. I want to start by just telling you my objectives today are to discuss the top reasons for Black Breastfeeding Week. And I say that because when we discuss Black Breastfeeding Week, some people want to know, why is this conversation so important? Well, I'm going to give you a lot of information, but I want to start by saying we need Black Breastfeeding Week because the rates of breastfeeding in the Black communities is so much lower than others. But we're going to celebrate and we're going to talk about how do you overcome some of the barriers. So we're going to discuss the barriers to breastfeeding in Black communities. We're going to identify some strategies for supporting Black families. Because I told Beth, what I want this to be is not about what we're not doing well, but I want to remind us how well we are doing. I want to leave you with some positive thoughts about our community, because the more positive you are about working with our mothers, the better it's going to be. The bottom line, Black communities have been abandoned, left behind, left out, and received lesser than the dominant race since we were forced to come to this continent. And I'm just going to keep it real. I'm not here to offend anybody. I'm going to be my authentic self. And if you know me, I try and shoot from the hip. I'm going to tell you my thoughts. And again, this is literature, but some of this is going to be my lived experience. I want to acknowledge the ancestors who came before me, who gave their milk when they had no other choice. God, and blessings to my mother, Joyce Allen, who introduced me to my first information about breastfeeding and supported my love of nursing and maternal child health. I want to thank and acknowledge the granny midwives, because there was a time when we could not go to healthcare providers, and the granny midwives protected our families, our babies, our mamas. I want to thank and acknowledge the breastfeeding and chest feeding and all families who provide human milk. I'm also going to acknowledge that I will be saying breastfeeding throughout, but I am talking to anybody who provides human milk or wants to provide human milk, our support mothers. I want to acknowledge all the healthcare providers, especially the community workers, because the community is where it is. I want to acknowledge our peer counselors, our doulas, and of course, our lactation consultant. And I also want to acknowledge and introduce you to my family. This is my son, Mario, and his family. And the baby is little Princess Riley, and she breastfed from the minute she was put on mommy's stomach up until now, and she's 22 months old. So thank you to my family. And I want to thank my tribe, the Breastfeeding Task Force. We advocate, we network, we educate, we take action. We come together with others to get things moving. And we have been working, this is an event that was held in my church, St. Benedict the African in Inglewood, where we came together with other providers to educate and talk to moms about the importance of providing breast milk for their babies. And now to the reason we're here. Big pause, collective rest for collective power. Everybody take a deep breath. 2021 is the 9th year for Black Breastfeeding Week. It starts on August the 25th and goes into the 31st. This year, we are honoring the need for rest. And with COVID and all the upheaval, the trauma, the drama, we need a rest. But at the same time, we take that pause so we can re-energize and prepare ourselves for our next journey. The founders of Black Breastfeeding Week are Kadada Green from Breastfeeding BEMFA in Detroit, Kimberly Seal Allers, Anaya Sandegole Ayoka. Black Breastfeeding Week was created to acknowledge and recognize the challenges and triumphs of our families who are breastfeeding. These are the 5 most important reasons. If you go to the blackbreastfeedingweek.org, these are the 5 top reasons, and there are other reasons, and I'm going to delve specifically into these 5 and give you some examples, but cultural challenges that are occurring for Black families. The health disparities that occur throughout our community. The high infant mortality rates experienced by Black families, you just wouldn't believe, and many of you know and understand what I'm talking about. The non-diverse lactation providers, and I'm going to tell you a story about why I became a lactation consultant. And at one time, I was one of only 2 or 3 Black or people of color as lactation consultants practicing in the South Side or the area of Chicago. There's a lack of access to support for promoting human milk for Black families. But I do too, Beth, want to acknowledge iSpan and the NOHE and also our state for all the hard work that they're doing to help make these things happen. I want you to think, what challenges and barriers have you heard from Black mothers about the struggle to reach their breastfeeding goal? I'd just like you to put some thoughts in the chat for us so we can collect those. And if we have time at the end and I didn't address those struggles, maybe we can go back to them. So thank you guys for being engaging. And I'll move on and tell you some of the things that I've heard. And as Beth said, I've been an international board certified lactation consultant since 1994, but a maternal child health nurse for over 40 years. And things I've heard, breastfeeding is hard. Breastfeeding is for poor people. Breastfeeding is nasty, and they say it just like that. Sometimes the mamas will say that baby's too greedy, they're not getting enough. Some people feel like breastfeeding is gonna tie them down. And of course, we know that especially in our society, many people see breast as sexual. But I want you to go back, and anytime we're talking, I always say we have to look back. There's an old thing that we think of in the African culture called Sankofa. We have to look back to our past to inform our future. And what I wanted you to think about is this is a picture of a Black woman nursing a white baby. She may or may not have been a slave, but what I want you to recognize is back in slave time and even afterwards, Black slaves or Black women were forced to wet nurse white babies. And the impact of this breastfeeding has moved on for centuries, for generations. And even after slavery was over, many Black women had no other choice but to continue to be wet nurses for financial support. We know that this in itself has probably caused a major disconnection from breastfeeding for many African-American women. This was in the Academy of Breastfeeding Medicine Journal, and I've tried to give you a lot of citations. So if you have questions about anything I'm saying today, there is a list of references, and I want you to do the work. Read those articles, look at those journals, call some of these people and talk to them about the work they're doing. But this is an example of what a slave may have said, and it's untitled. I wish I dried up. I wish every drop of my milk slipped past those pink lips and nourished the ground where the bones lay of my babies, starved while I feed their murderer. I wish I dried up so the Mrs. Baby would dry up too and be brittle so I could crumble them to dust, return them to the ground where all children of my bosom lay. And this is Hess Love 2017. So just imagine how that mother must have felt. Think about the psychological impact of breastfeeding among Black mamas, the social historical context of slavery, racism, the biased treatment. There are many stories about the rules that the plantation owners had for wet nurses. For example, a wet nurse could work so many hours in the field, then she had to go nurse the master's baby, and her baby was oftentimes left unfed unless someone else in the clan would feed them. And again, this was forced, there was forced weaning. She had to wean her baby at a certain point to have enough milk to continue the breastfeeding. So those are challenges that occurred in the past. But now I want you to think about some of the challenges, some of the cultural challenges that African-American and Black women are faced with. Think about it. Think about the stories about the mothers and their labor. Black women are experiencing high levels of stress. There's reports of lower rates of breastfeeding because of this. Black women have to return to work at a faster rate because many of them are in underpaid jobs that don't have the benefits. I can remember stories where there was one mother who came into labor and delivery, and while she was in labor having her baby, the father of her baby was brought into the ER shot. I can remember taking care of mothers who would be crying because their significant other, or the father of their babies, was not here because he had been killed either recently or soon after she conceived. These mothers, despite the crime, despite mass incarceration, despite the violence and the current level of racial upheaval, still managed to breastfeed. And if you take a look at this picture, one of my friends, Brenda Reyes, shared this with me years ago. This was a mural that was on the south side near 63rd and Kedzie. And look at the thing that the woman has on the back, schools, not jails. Think of the stress that she's experiencing. But what I do want you to know that there's an article that is cited in 2019. Robinson says that racism in the workplace negatively affects Black breastfeeding of Black mothers, but conversely, the experience of racism with police encounters, there was a 21% of the women who experienced that was associated with increased breastfeeding initiation and duration. And by the way, this mural on 63rd and Kedzie is actually just a couple blocks away from where those police were recently shot, and one of them actually passed, unfortunately. Think about the health disparities. I remember going to conferences, and every conference, when they would talk about blood pressure, heart disease, every time they talked about it, and it's higher in Black families, and it's higher. All the diseases were higher in Black communities. And I'm like, why? Is it the community? And we'll talk a little bit about that. But what I want you to think about is that health of that family, that health of that community is going to impact that mother. And this is from mortality, a database, and I think I provided the resource, but it says that ensuring that women have access to quality care and improving social, economic, educational, and environmental detriments throughout the entire course of their lives can have an impact on a healthy pregnancy. So I want you to think about how the bias of a healthcare provider can change not only the impact of her pregnancy, but the impact of her nursing, the impact of that baby's health, the impact of her family, the impact of that community's health, just by providing breast milk. The reports of unequitable care during the perinatal period are cited throughout the literature. And it's estimated that improving breastfeeding could prevent an additional 20,000 maternal deaths from things such as breast cancer. We're not even talking about the financial goals, but I want you to recognize that this is a public health issue. It's not just a breastfeeding issue. And this is an article that I actually was blessed to co-author with some other peers from the task force and from the community. And we talked about the health disparities specifically that were occurring in our community in Inglewood, where I was born and raised. They closed down the birthing hospital. So Inglewood is now a birthing desert. There's access to limitations. So if you live on 63rd and Halsted or near 63rd and Halsted, which is in the center of Inglewood, and I know many of you are not from, but you have to go miles to find a hospital to do deliveries in. And some of those hospitals may or may not be as welcome if you didn't get your prenatal care there. So the structural racism and barriers are real. Some of those barriers show up by the disparities in the number of African Americans who are breastfeeding. I have to throw a little bit of data in here, a little bit of research, and I want you to pay attention to the area that is marked in red. That is the non-Hispanic Black population. And across the board, there's a limited amount of breastfeeding ever, and ever means if they put the baby to the breast at all. The number of Black mothers who are breastfeeding in 6 months and in 12 months are much lower. And definitely the number of mothers who are exclusively breastfeeding is much lower. And then exclusively breastfeeding for 6 months is just not that common. We know that the risk of not breastfeeding in our community, we have a lot of diseases, and some of those diseases that could be impacted by mothers providing human milk would be asthma. So babies who are not receiving their human milk have an increased risk of asthma, increased risk of obesity, diabetes, otitis, and SIDS, and that can lead to many of these infant mortality. We talk about one zip code can adversely affect the health and breastfeeding, and it's an important part of the infant's health for that baby to get breast milk. This is some information I actually received from Beth, and thank you for sharing, that may speak to some of the people who are down in central Peoria. And if you look at this in Peoria, the last slide, it breaks down the zip codes. And in this area, Dunlap is doing real well at 70%. But if you look in the zip codes, 61604, 61523, and down to 61605, these are areas that have lower socioeconomic status, and the breastfeeding rates go down tremendously. So again, I just had to throw a little data in here to show you that by zip code can impact how you breastfeed. This is some statistics that look at overall Black breastfeeding, and I just wanted to compare 2009 to some of the most recent in 2015. And as Beth said, we met years ago, and I can remember back in 2007 when we first started looking at a lot of this data, the rate of African Americans and Black moms breastfeeding was so low. So example, in 2009, the initiation rate for Black mothers was only 60.7%. And just in a matter of 6 years, in 2015, it was up to 69.4. So for the sake of time, I'm not going to go over all this data, but just take some time to look at those report cards. But I do want to share that Illinois breastfeeding rates have increased dramatically, but this is overall. So right now, the last data I found was at Illinois, 84.2% of mothers initiate breastfeeding. And we know that in the Black population, that's going to be much less. Why is human milk so important? Breastfeeding provides unmatched health benefits for babies and mothers. It's the clinical gold standard for infant feeding and nutrition. And breast milk is specifically tailored to meet the health needs of that growing infant. We, as healthcare professionals, must do more. And this is from Dr. Ruth Peterson. Human milk does make a difference. It's the best first food. It provides the safest nutrition for babies. The Academy of Pediatrics recommends exclusive breastfeeding for 6 months. Black infants are 15% less likely to ever breastfeed. That in itself can impact infant mortality. The rates of infant mortality in our community is about twice as high as in non-white or in the dominant culture. So just imagine a mother having a baby and being afraid, knowing that her baby is at risk to pass. Not only are we at risk for high infant mortality, but one of the reasons for the infant mortality because it's the high rate of prematurity. And I can share, even in my own family, we have many of my nieces, and I have almost 100 nieces and nephews, but several of them have been born premature. And we know that when they're in that NICU, they're at risk for necrotizing enterocolitis. And unfortunately, I do have a nephew who passed from necrotizing enterocolitis. He never got out of the NICU. So we know that infant mortality can be impacted by breastfeeding. We know that there are many associated risks of not breastfeeding. And yes, I'm repeating myself. Health disparities for mothers and children occur when they are not providing breast milk or human milk. The solutions to the problem of higher infant death eludes medical health policy. People for years have been trying to figure out, doing studies, do African Black babies die because of what? Smoking, everything, asthma. We don't know, but it's important that we do more research to find out how breast milk is helping babies. Another reason that Black Breastfeeding Week is important is because of the non-diverse lactation providers. And as I told you, When I became a lactation consultant back in 1994, I was one of few. I only knew 2 other Black lactation consultants within the city of Chicago. But I'm proud to say that we are making some changes. Health Connect One and Reaching Our Sisters Everywhere came together, and they provided a specific training. They went into the community and welcomed change leaders in our community to come to this training free of charge, so that they would have the tools that they needed to sit and pass the International Board Lactation Consultant exam. We need more lactation consult for our Black community. And this is where I want to uplift all the people you see in that picture who are working to support our mothers, especially Rose and Health Connect One. And I want to also give thanks and acknowledge quickly some of the community transformers. And I want to say this is not everybody, but some of our community transformers, as I say, Rose are Reaching Our Sister Everywhere, Bosom Buddies in Indiana. These are some Black organizations that are working specifically to help moms breastfeeding. The Black Breastfeeding Coalition, Sister Friends, the African American Breastfeeding Network in Wisconsin. And we have a lot of allies in Health Connect One and USBC, but further research is needed to address the racism, the bias, and the discrimination toward Black families. And as I say, that's the reason I became a lactation consultant, but I'm running out of time, so I can't tell you that story. But we know a lack of access to support. So insurance bias, where you have Medicaid mothers who get one level of pump, and you get private insurance mothers who get a total different pump. You have people, healthcare providers, and people within the community who look at a Black mother and say, oh, she's not gonna breastfeed. I'm not gonna even waste my time. Instead of looking at her and saying, hey, she's gonna be one of that 15% who's gonna breastfeed and is gonna breastfeed exclusively. So if I can come to this woman with a good attitude, I may impact her life and her baby's life. We need more research on how racism impacts and how we can support moms breastfeeding. Family and community support are key for successful breastfeeding. And there's a socio-ecological framework to breastfeeding where we look at the individual, we look at the interpersonal relationships and how that, along with the community. So this framework helps you look at how policies enforced on people can impact their breastfeeding experience. Think about why mothers don't continue to breastfeed. If we can step up and help these mothers who are breastfeeding overcome some of these challenges, then they can reach that 6-month or that year goal of exclusive breastfeeding. Many mothers feel like they discontinue breastfeeding because they don't have enough milk. They're having breast discomfort because maybe they went back to work and they're not pumping it often enough. They're having the baby rejecting the breast because maybe they've gotten used to bottles and they don't know how to pace feed. Maybe the mother got sick because she went back to work too soon, or maybe she has preeclampsia or hypertension. And definitely many mothers are saying that they do not feel supported by the healthcare providers. So some of the root causes of the healthcare providers not providing that result is basically discrimination. We know that there's first food deserts and there are many policies and institutions and people in our community that are standing as roadblocks to Black babies getting milk. Historically, Black communities suffer from redlining, hospital and industry closing, miseducation, loss of opportunity, the poverty, and that goes back to that picture where you see people who are living in poverty in Peoria have a lower breastfeeding rate. And again, that insurance bias. If I'm a lactation consultant and I know if I go to this insurance company, which is funny, you're gonna be talking about insurance coverage next time, but if this insurance is not gonna cover me, I may not spend as much time working or talking with that mother as I will the person that has private insurance, because I may get paid and then I can get another lactation consultant. So that's why it's important that we work on some policies to help improve the amount of money that is put into lactation consultants and peer counselors and doulas and healthcare providers in the community to provide breastfeeding. We need the organizations to come together to do the training and to support mothers so that they can overcome those barriers. And this picture I just love because she's breastfeeding that baby. And I just put that in as a reminder about the racial disparities in breastfeeding mothers. And this is a little older data, but I just wanted to remind you again, in 2015, after all the work that was being done, so that 69% of Black mothers were initiating breastfeeding, but the Healthy People goal was 81.9. So we are not reaching that breastfeeding goal. Look at the exclusive breastfeeding, and we know that even one bottle can impact that gut. And there was a really excellent talk recently about the impact of human milk on the microbiome of the baby's gut. So we know that having any breast milk is excellent, but having exclusive breastfeeding is the gold standard. And this looks at Illinois. So in Illinois, we were improving our rates, but again, we need to continue to work on that. This is the call to action that the Surgeon General put out in 2011. And this is my call to action to each and every one of you here. There are many barriers that exist for mothers who want to breastfeed. They shouldn't have to go it alone. Whether you're a clinician, a family member, a friend, or an employer, you can play an important part in helping mothers who want to breastfeed. Strategies for supporting Black families who choose to breastfeed. From day one, start that baby skin to skin as soon as that baby is born. Talk to the mothers about the importance of skin to skin, even if they say they don't want to breastfeed. Skin to skin is going to help. And of course, this baby has her eyes opening, looking right at mama because she was a totally unmedicated birth and she latched immediately. You as healthcare providers can influence what happens to that mother. So this is where you have to start. You have to start at home. You have to start by assessing your own feelings, your own beliefs. What's your implicit bias? Maybe you need some implicit bias training. Think about what we call the ghost in the nursery. And that's anything that you've experienced in your own self, you may reflect onto this mother. How did the experience that you had with that one Black mother that says, that baby greedy, I'm not gonna do it? Are you going there and you work with that mother and she changes her mind? Is that gonna affect how you approach the next mother who looks like her? Think about that. The power is in the community. This is a group, and again, Health Connect One, a luncheon, these are all breastfeeding mothers. So when you get an opportunity to go into the community, recognize that the answers are in the community. Don't come into a Black community trying to make changes without listening to the needs of the people from the community. You may have to find resources. These mothers may need a way to get to that breastfeeding class. Do you have a breastfeeding class or a group of Black mothers that can invite other Black mothers? Because that's how we're gonna have improved breastfeeding, by mothers, helping neighbors, helping the community, because that's the way it used to be done. Pay attention to what they're saying and work on policies in your hospital that's gonna help keep these mothers breastfeeding as long as possible. Bring the support person into the picture. When that dad shows up for that clinic visit, or when you go into their home and that dad is in the back room, or that other parent is in the back room, invite that other parent, that support person into the picture. Because without them, that mother is not gonna be as successful. Remember, Black people are comprised of large heterogeneous populations. There are a lot of different cultural experience. The African-born Black person has a different experience than the American and Afro-Caribbean. So know what practices each group is occurring. Come as your genuine self. If you're not interested in helping that mother, find somebody who is interested. Build a rapport with her. Explore her beliefs and her values. So ask her, how do you feel about breastfeeding? What's your experience with breastfeeding? Engage her. Listen to her questions and concerns. If she says she's concerned that it's gonna hurt, then don't just fly over that. Tell her, yeah, I've heard people say that they are concerned about it hurting. So affirm what she says to you and then go on to educate her. But don't ignore what she's saying to you, because that's something a lot of people say. My healthcare provider didn't listen to me. And it's a team approach. If you are a physician and you don't have time to help their mother, then get somebody else on your team who can. Provide breastfeeding material with pictures of mothers that look like her. Provide prenatal education early and often. And make sure that when she walks into her office or any flyer that you hand her has images, positive images of breastfeeding. Begin early and often, and that will help decrease the health risks in Black moms, such as the risk of breast and ovarian cancer if she breastfeeds. It will decrease the risk of type 2 diabetes. There will be a reduction. We know that mothers who do more skin to skin and more breastfeeding during those first couple of days in the hospital will have a less chance of having postpartum bleeding, because she's got all that oxytocin coming from having that baby skin to skin. There are many opportunities to improve breastfeeding in our communities. And unfortunately, I think I'm running out of time. Beth, let me know if I could continue or if I need to cut it short. But these are some opportunities to improve breastfeeding in our community. The federal and state laws, invest in education, improved employment opportunities. And again, I want to thank ISPAN, No Heat, and do more training and community collaboration. There are a lot of things going on in Illinois over the years that have helped with breastfeeding. Have culturally unbiased prenatal support. Have some peer counselors and doulas of color. Make sure you educate the mother about going back to work and do some postpartum follow-up. Prepare for our future. Listen to our families, invite their stories, but most of all, uplift and celebrate our breastfeeding families. Community members and stakeholders are key. Be an ally. Learn about the issues that are occurring. We have to identify ways to continue to breastfeed babies. And again, the call to action. I want to end soon, but I want to share, this is information that I pulled from Saving Today. These are the recommendations from the African American Breastfeeding Blueprint. I gave you the spot to go get it. It's important that we have programs and initiatives. We change policies. We use the data because there's not enough data even on the African Americans, Black mothers who are breastfeeding who don't go to WIC. A lot of the data for Black mothers are from WIC data, which is great, but we need to know what all of our community is doing, and especially encourage and include that community. And I want to tell you, it takes a village to breastfeed a baby. And these are just some examples of some of the organizations that are working to breastfeed our Black babies. And in the end, be there to support that baby until she or he is ready to stop nursing. And thank you guys for being here to listen. And my professional name or my lactation name is Mama Joanne. This is my contact information. I love to talk about breastfeeding. So if anybody has any questions or concerns, I think we have a few minutes to address some questions. And just a reminder that some of these things can be found if you go on to the United States Breastfeeding Committee website, the Illinois Breastfeeding Task Force site, and definitely look up the Chicago Region Breastfeeding Task Force. Look us up on Facebook and become involved. And as I say, I included a lot of references, and thank you guys for being here to listen with me today. So, do I have any questions or concerns that I should address first, Beth? I see the chat.
Thank you, Joanne. That was great. In the chat, we don't have any questions yet, and we do have a few minutes. So if anybody has a question, you can put it in there. I have a question though, Joanne. I watched a really insightful webinar that was more just a very real conversation about with a Black mom yesterday, sharing her experience with birth and having her baby in the in the NICU and then subsequent breastfeeding. And one of the things that she said is also what you said, and that is that other women need to share their stories. That it's those stories that are inspirational and can really motivate other Black women to breastfeed. What is the best venue? Like how do we create those environments where those parents can share their stories?
That's a great question, Beth. And one of the things that we know, remember Leche League? When I would send people to Leche League back in the day, because there were no Black groups, mothers would come back. That's not a group for me. We need to find groups for Black mothers to come to so that that's where they can share their stories and be in a safe story. I know that there are a lot of hospitals that have support groups, but when a Black mother shows up to that support group, she's sitting there with other women are just not having some of the same issues and concerns. So I know that there are a few small Black baby cafes throughout the United States, but there is not a baby cafe in Illinois. And I actually tried to start one when we had a grant, but it takes a lot of work. So my answer is, if there's not a group of mothers that has a safe place, then start one. iSpan did a focus group where they brought mothers in to ask them what are their concerns. So just like we brought those mothers in for a focus group, when mothers are discharged, they need to have a place that they can go to ask questions and be safe. Because as an African-American mother, I can tell you, sometimes when we show up in the room and we're the only one, we feel out of place, we're not gonna engage and we're not gonna be involved. So provide a space, talk to the mothers, ask them, where can you meet? And right now with COVID, many other people are probably saying, I don't want to meet. So there are ways to do a virtual platform with these mothers.
Thanks so much, Joanne. Somebody had a question that a couple other people would like for you to address. Linda Kennedy, she said that it sounds like maybe a issue that she's had come up is a parent might work in a pork factory with a place to pump, but the parents feel like the milk could get contaminated from her clothing or even storing in the facility. So do you have any recommendations for how you would respond to a parent with concerns about that? They feel like the milk could get contaminated from her clothing or even storage in that facility.
The first thing I would do is, and again, I don't know the exact name of the people, but anytime there's something in a workplace that can cause harm, there has to be a list of what's there. So she needs to find out what are the things that could cause harm there. And that may mean me calling up to, and again, I don't know the governing bodies, but there has to be a list of any contaminants or any products within that area that would be harmful, and then recognizing those things. So if she doesn't want to store the milk there, I may talk to her about having a special cooler bag to take in, and maybe how to put that cooler bag. You know, as nurses, we double bag things to prevent contamination. I may talk to her about having a shawl to cover herself while she's pumping so that the milk goes right into the bottles, and then making sure she's cleaning her hands before she touches anything. If she can't change her clothes, having a clean garment that she can put on over her clothes and then expose her breast. And again, keeping the things clean, but maybe actually advocating to find out what are the contaminants within that pork, because I don't know, but I can imagine there's blood, there's probably feces, some tissue could be a source of contamination, but specifically hand washing, and then making sure that her boss knows that she has a right to a clean place to pump. That's not just a law in Illinois, but that's a federal law that if they have workers there, they have to provide a clean place for this mother. It don't have to be the perfect place, but it may mean us as advocates going in and talking to this and then offering them an award if they win. You know how we have that gold award for people who are baby friendly in the workplace, so that may mean having that award for them.
Great, thank you.
Joanne, I have
Hassan,
a question.
okay.
Hi, I see Vera has a question. Hi, Miss Vera.
Hi, dear. Your presentation was absolutely wonderful. Thank you. And I was so happy to hear you say that it takes a village to breastfeed a baby.
Yes.
That is so true. And there's some things that impact that breastfeeding that we haven't talked about, and that's okay. I'm thinking about insurances that pay for the hospitalization and deliveries and all that, and I'm thinking also of physicians. I don't hear how they are involved, except to tell a mom that after 6 weeks she can go back to having sex, when actually 3 months is the ideal, when all of your systems go back to their normal position and functioning. And for 3 months, it seems that you should be just the baby mama only, but who talks to these fathers and significant others about that?
Well, let me just tell you this. Thanks for the question, Ms. Vera. And I didn't address the insurance because I knew I only had 30 minutes.
I know.
I wanted to uplift our mamas. That's what my talk was for. But
absolutely.
If you look at my talk, I did mention insurance bias. And I also mentioned, as a healthcare provider, I had a slide. And when I say healthcare provider, I do that to encompass everybody, because sometimes it's the doctor, the midwife, the nurse practitioner, the doula. I'm talking about anybody that touches that mother. Many of the mothers in the Black communities get their education from WIC, but WIC is often seen as a formula feeding organization, but WIC is not. WIC is there as a nutritional supplement. So one of the first things WIC in most instances is talking about is breastfeeding. But because mothers don't see other mothers breastfeeding, it's not something that is in their mind right away. So who talks to mothers? Everybody, from the second, and even me as a nurse and lactation consultant, my granddaughter sits here with me, and she's with me on a lot of things. So she's hearing this.
Sure.
And I heard this as a little girl. So we don't start talking about breastfeeding. Mothers need to be breastfeeding in the community so that other people see it. And it's the norm, instead of a mother breastfeeding in public and having somebody shame her. So it has to start in your home. As a baby, starts with your mother. But again, that goes back to that historical point where many of our mothers in the African American communities had to go back to work. So it was seen as a status to be able to give formula. But now we recognize that human milk is alive. It's what we need for our babies to keep the life in our community. So thanks for your question. And Beth, how much more time do I have for any other questions, if there's any?
Well, we are actually a little bit over, but and so thank you for everyone who joined. And if you want to drop off, great. But Joanne, do you have time for me to ask you one more question?
Sure do.
Okay.
I'm right here.
So Rosalind asked, I think that this was a follow-up to when you were talking about, getting Black moms together to share their stories. She said, is there any way we can encourage mom to feel more comfortable in groups, even if they are the only person from their culture? To be successful in life, we need to develop this skill. That was the comment that she made.
Okay, so I think that the way you make a mom feel more comfortable, so say you're the leader of that group, number one, don't use her as an example and I'm going to tell you, as an African American woman, I've been the only Black in many instances over my life. And sometimes the way I felt more comfortable is when I'm treated like everyone else, but don't use me as an example. And oftentimes that's what happens, because you're the only Black. They want to always, so it's up to you to learn more about what our culture believes and include that in what you're talking about. But I'm gonna tell you the truth, it has to come from the group. If the group welcomes her, because I've been in groups and I can remember, for example, again, as a nurse, I went to a meeting of the NICU, a postpartum meeting, and I was walking around. I knew a lot of these women, and they were talking in groups, and I would go to the group and try and engage in the conversation. And oftentimes they would actually turn their back or turn in a way that I wasn't part of that conversation. Then when I got ready to leave, I was finished because I wasn't feeling comfortable. Someone had a question. They know I'm a nurse of lactation. So I'm getting ready to leave. Somebody says, "Hey, Joanne, come here." So I was welcomed in the group once I had something to give them. So the way you do it is, number one, say, "Hey, do you have any friends that you want to invite to this group? Who else can we invite to the group?" You talk to her, ask her, what does she need to be welcome in that group? Because again, if she walks in, and oftentimes you come in and people are already in their cliques, or maybe even if it's the first time you meet, the way you approach her as the leader, the way the other members approach her. But bottom line is, if she's the only person, she's probably not going to feel as comfortable as the rest of them. But you acknowledging, number one, thinking yourself, "Hey, this young lady may not feel at home," and watch her body language. Look at her eyes. Again, try and engage her, but not overly engage her. So you want to make her feel welcome, but don't make her feel like it's she's something unusual. Because as Black people, we oftentimes are the only person in the room.
Very wise. Thank you so much, Joanne. I'm just gonna finish up here. Desiree says, "Thank you for the energy and passion you have for breastfeeding." Susan says, "Thank you for this informative presentation. I was a breastfeeding mom and often felt like I was in it by myself. My mother breastfed and was generous in sharing that information, but then also that she only breastfed a few months. It was hard to find at that time to find other moms, and the support is so very important." So again, it's, sharing those positive stories. So Sonia, yes, the slides will be made available. I will be sending them out to everyone. You're gonna have to look at the chat because there's all kinds of good stuff coming up. Okay.
Thank you all.
Okay, but thank you so very much, Joanne. This was wonderful. And thank you to everyone who joined us and hung in there with us for the extra minutes that were very worth it. And again, I hope that we will see everybody interested in learning about insurance and a reimbursement for breastfeeding support September 21st, but I will send that information out. Have a great rest of your day and a good weekend, everyone. Thanks so much, Joanne.
Thank you, Beth, and thank you everyone for being here, and thank our breastfeed mamas. So when you see a mother breastfeeding, smile at her, clap, put your hand on her shoulder, uplift our breastfeeding mothers.
Awesome.
Okay.
Thank you.
Thank you all.
Good, Joe.
Yes, ma'am. Happy Black Breastfeeding Week to all.
Yeah. Thanks, Joanne. Okay. Thank you, Joe.
Thank you for being here, church.
Okay. Support our girl.
Bye-bye.
Hey, honey.